I am beyond thrilled to welcome you to this special event celebrating the 2020 and 2021 graduates of the Johns Hopkins Bloomberg School of Public Health. My name is Sonia Sarkar, and as a graduate of the class of 2020 and as second vice president of the Johns Hopkins Alumni Council, I have the pleasure of hosting this afternoon's program. And while I know that a lot of us are really regretting that we didn't get to dress up in sweltering robes and sit through hundreds of our classmates' names being called out, I promise you that this last event today before we adjourn will be just as fun as any traditional graduation ceremony. In just a moment, we will dive in and hear from our speakers. And before we do so, however, we also want to take a moment to root into true public health practice. One of the most important parts of our work is identifying and saying out loud the root causes of health inequities in our society. And doing so is an unmissable first step in enabling true healing. So to that end, we'd like to acknowledge that the School of Public Health and School of Medicine campus that we're sitting in today is located on the unceded ancestral lands of the Piscataway and Susquehannock peoples. We recognize this reality as well as the enduring presence of more than 7,000 Indigenous peoples in Baltimore City, representing the Piscataway, Lumbee, and Eastern Band of Cherokee community members, not just to express our words, but in order to acknowledge a history of systemic genocide of these peoples that has impacts, including health impacts, to this day, to counter the erasure of Indigenous communities, and to celebrate their contributions and ways of knowing, which we all benefit from today and every day. Colonialism and white supremacy, of course, has and continues to play a role in the disenfranchisement and harm of Black Americans and other people of color, including those who live in the neighborhoods surrounding our school. These communities have been fighting systemic oppression over decades, and yet have repeatedly found ways to care for one another, to cultivate community wisdom, and to build healing spaces that frequently generate solutions to some of our most intractable health problems, if only we're willing to listen. Given this, we hope that this acknowledgement can serve as an open invitation to honor Indigenous, Black, and other global movements for freedom and self-determination. We give thanks to the past, present, and future stewards of this land, and we aim to hold ourselves and the university community accountable to them. We also want to thank and acknowledge all of those of you who have been on the front lines of the COVID-19 pandemic. So many of you are in the room with us today. Whether it's healthcare workers treating patients during an incredibly uncertain and isolating time, or as public health professionals working to contain the spread of the virus in the face of frustration and misinformation, or, importantly, the essential workers who have served as a crucial backbone for all of us in order to just get through our days, we see you. We recognize all of the public health and healthcare professionals, as well as nurses, teachers, care workers, service workers, community organizers, and so many more who have been on the front lines working tirelessly to ensure that we can all move forward collectively. And speaking of moving forward collectively, let me just say that it's a pleasure to see so many of you here in 3D, not behind a screen, whether you traveled from another country, across the United States, or simply across town. As a student, for me, the most amazing parts of my experience were the people that I met while here at the school and at Johns Hopkins University, and we hope that you've also enjoyed the opportunity to connect with your fellow alumni and with the school as well. And for those of you that are joining us through phone or computer screen, I'm also grateful for the chance to be able to connect with you wherever you're watching. The ability to build connections across the globe has never been easier, and that's something that I know that our alumni office is eager to continue facilitating. Speaking of us alumni, I just wanted to acknowledge what an extraordinary time it is to be dedicated to public health. We and all of those who have supported us, so our families, our friends, our communities, some of you who are also with us today, we've been through so much over the past 2 years in the field, in the classroom, and then in our homes as well. There are more than 27,000 of us alumni living in over 150 countries who have taken a leadership role in all areas of pandemic response, while not losing sight of the existing public health challenges that we have, particularly when it comes to social change. So our alumni are fighting for policies to address the root causes of gun violence. They are conducting the essential vaccine research that will keep millions healthy, and they're designing programs that look at health through a racial, economic, reproductive, and global justice lens. So much has been said and will be said by our amazing speakers today about how much the past few years have shifted our world. And so I actually wanted to go back to the past a little bit to illuminate how we might also think about the future. 17 years ago, I attended my first ever public health lecture, actually right in this room. I thought it was right down the street, but we're in the Turner Auditorium, and this is where I came. And when I did attend, I and my family had no idea what public health even was. My family's here today, and I remember really wondering, what was this field that I had heard about but knew very little about? And the talk that I attended was about water fluoridation, and while that may not seem like the most happening place to be, I was taken. I was fascinated with the idea that there's this whole field that's dedicated not just to treating what's inside of us, but also everything that surrounds us. So our places, our policies, our societies. And to me, it just made sense. Health and well-being existing not in a total vacuum, but in this constant push-pull relationship with the societal realities of our world. And to be fair, that relationship is really complicated and really frequently overwhelming. And yet, as public health practitioners and researchers, we're out there trying to tackle whatever sliver of that we can every day. As a student volunteer working with patients in clinics across Baltimore, for me that meant treating food insecurity and housing insecurity as a part of standard clinical care. For my friends in cities across the country, it's meant not only tracking violence as a public health issue, but also supporting violence interruption programs that deploy trusted community messengers in order to build relationships with the people that they know. For those conducting research in the lab, it's meant asking different questions about how to move faster or deploy new technologies, but also raising your voice about something you have the slightest hunch about, even if you're not at the top of the hierarchy within that lab. And for those conducting research on behavior change campaigns, it means asking how the people that we're trying to reach can be part of the design of that campaign in the first place. And that's what public health is. It's constantly adapting, always focusing on the next challenge ahead. And it's also why, with all of us gathered here today, what I'm most excited about, given everything that we've experienced over the past 2 years, is the future of public health that we will imagine together. How will we build the public health messages that cut through all of that noisy information saturation of today? How will we, given the ways in which our work worlds have been upended, re-envision the future of work so that it takes less of a toll on the physical and mental health of our workers? How will we radically change the expertise that we seek and honor the role of lived experience in spurring innovation? And how will we all, as alumni, call each other up, partner with each other, in order to surface creative, multidisciplinary ways of tackling our biggest health inequities? Our school has been at the cutting edge of health for decades because we've been afraid to ask these questions, unafraid to ask these questions and others, and also because we've been unafraid to center health as an attainable right, even at a time where, as we know, that is not always a guarantee. I'm so proud to share that type of legacy with all of you and those of you who are joining us online, and I hope to live up to it with all of you too. And to speak more to that legacy, I now have the honor to present Dr. MacKenzie, Dean of the Bloomberg School of Public Health.
Well, thank you so much, Sonia, for those great words. It's wonderful to hear how public health has shaped your life and all that you're doing now. So thank you. And thank you for your service to the Alumni Association at the university level as well as the school level. It's great to be with you all here in Baltimore, but I also want to give a shout out to those who are joining us online. Wherever you are, it's just wonderful to have this opportunity to be with you here today. I know some of you that are here in Baltimore are walking the halls of our school for the very first time. It's pretty amazing. Others of you have run into classmates that you've only known via Zoom and have reconnected and connected anew in person. So that's really great to see as well. I also want to welcome the friends and the families, loved ones of our graduates who, and I speak from past experience. My friends and family were so important to me when I was going through my education, and I think we owe them a lot of thanks for their constant support and throughout your education. We also have some staff and faculty who have joined us here today, and I do want to welcome all of them as well. And of course, I do want to take a minute to thank Erica Youngst, that many of you know very well, and her staff. They've done an incredible job of putting this weekend together, and we appreciate all your efforts. So we've never had an event like this before, but of course we've never lived through a pandemic like COVID-19. But as we were writing these words, I remember, well, we did back in 1918, right? 1918 was the year where we graduated our first class of public health students. And that was the year, that was at the height of the great influenza pandemic. So we are in a very interesting moment in history. Having so many recent alumni together is so very special. You come from areas across the United States and across the world, from Canada, France, Brazil, Ghana, and other places. And it's just so wonderful to see you here together in this room. You also come to us from many different fields. You are working to improve health systems, address health equity, communicate public health initiatives, deliver care to those most in need, and so very much more. We are so very proud of all that you've accomplished in a very short time since you graduated from the School of Public Health. And you graduated just in time. Over the past 2 years, we have seen how much the world needs your intellect, your training, and your ambition. And I think we'll hear this over and over again today. These are difficult times. The pandemic continues to take lives and opportunities. White supremacy and injustice plague our communities. Refugee and humanitarian crises have taken hold in Ukraine, Yemen, Afghanistan, Tigray, Syria, and elsewhere. And meanwhile, many of us are deeply troubled by the likelihood that the U.S. Supreme Court will strike down Roe v. Wade. And if that happens, and it could be any day now, there will be profound implications for the health of individuals, families, and our communities. And of course, gun violence is on all our minds here in the U.S. We were most recently shaken by the devastating mass shootings in Uvalde, Buffalo, Tulsa, Philadelphia, and other places. But we also must keep in mind that each and every day over 124 people die at the hands of a gun. Gun violence and the intersection of gun violence and racism in the United States is a public health crisis of monumental proportions that we must address to secure the future of our country. So I ask that we all take a moment of silence in recognition of those who have unjustly suffered or lost their lives here at home and also around the world. Now, I know how daunting all of this feels, but as you know, public health has the power to make a difference, especially in the most difficult circumstances. And seeing you gathered here together gives me hope. Of course, being at this event is not something any of us could have anticipated, just as we could not have anticipated the last 2 years. It's a reminder that life, like your career, does not always go as planned. What matters most, however, is how we respond to the unexpected. Success demands that you adapt to changing circumstances, and you did that beautifully during your time here at the Bloomberg School of Public Health. You showed grit and determination as you adjusted to even the most surprising and, let's face it, some disruptive events. As you move forward in your work, you will face disappointments, failures, setbacks, and of course, unexpected opportunities. As you do so, I urge you to remember that you have the skills to pivot and persevere. You should not be afraid to change course or take chances. Public health is not static. Viruses will adapt, human behavior will shift, environmental threats will emerge. The world is always changing, and so must our work also change. Here at the Bloomberg School, we have public health heroes who are powerful examples of this. The paths they followed were not obvious or straight. However, where they ended up was truly extraordinary. And just give me a moment to share a couple of examples with you. One of my personal heroes is Professor Merida Susan Baker. And hopefully some of you may have had a chance to meet Susan and work with Sue. She is often called the mother of injury prevention. She helped define the field as a scientific discipline. But that's certainly not something she planned for. In the 1960s, Sue got a chance job coding epidemiologic data. She was new to computer programming. Again, remember this is back in the 1960s. New to computer programming and to public health, but she loved math, and she was a quick study. That job led her to the MPH program. She soon took on a research project in a medical examiner's office where she read the gruesome details about too many so-called accidental deaths. Deaths, she surmised, could have been prevented with a simple change in the environment or a policy that could separate people from harm. From there, her voracious curiosity took over, and for more than a half a century now, she's been finding ways to make the world a safer place. She exposed deficiencies in trauma care, promoted the need for child car seats, and helped pioneer a new field in public health. And those of you who know Sue appreciate that she always went deep in her investigations. When she was studying truck crashes, she got a license and drove an 18-wheeler. When she was studying plane crashes, she got her pilot's license, of course. Now, none of that was what Sue planned for, but she changed her path, and then she changed the world. Let me also tell you the story of Matthew Santosham, who I'm, again, sure some of you in this room, in this audience, are lucky enough to know. He is the founder and director emeritus of the Bloomberg School's Center for American Indian Health, but that's certainly not something he planned for. As a boy growing up in Nepal, Matthew was shocked by the sight of such children with distended bellies. His mother told him he should become a doctor and help as many children as he could. He took that message to heart and spent his life striving toward it. He was working in pediatrics in the U.S. when he was given the opportunity to join a diarrhea study in India. But then war broke out, and the study was canceled. His dreams seemed shattered. But his mentor scrambled and found him an alternative study, a study on the White Mountain Apache Reservation in Arizona. Now, this was meant to only last 6 months to a year, but Matthew would go on to spend more than 30 years working with Native American populations. With their partnership, he would demonstrate the effectiveness of oral rehydration therapy as a treatment for diarrhea. That breakthrough has saved an estimated 50 million lives. He went on to establish the Center for American Indian Health, a center of excellence here at the school. It now works in partnership with 150 tribal communities across 23 states to design and evaluate public health programs. None of that was what Matthew had planned for, but he changed his path, and he changed the world. And with us today is another hero, Alumna Lauren Underwood. During an undergraduate nursing course in politics, she gained an unexpected passion for health policy. She came to Johns Hopkins to earn a joint master's degree in nursing and public health, and would go on to serve in the Obama administration. When she saw the Affordable Care Act was in jeopardy, she felt compelled to try something new and something big. So she ran for Congress, beating out 6 contenders in the primary and then unseating a 4-term incumbent. She made history as the youngest Black woman to serve in Congress. Now, she'll tell us more about her work in a moment, of course, But she's another shining example of what can happen when you chart your own course. Sue, Matu, and Lauren all have powerful stories. They show that what happens when you follow your passion, when you follow your curiosity, when you change course, take chances, and adapt. In fact, I can tell you that being dean is not something I ever planned for. After wrapping up my term as chair of our Department of Health Policy and Management here at the school, I plan to return to my research full-time, which I was really excited about. But then I was presented with this opportunity to become dean. I deliberated long and hard, and as much as I loved my research, it became clear to me that I could have broader and deeper impact by accepting the responsibilities of dean at a school that I have called my home for nearly 50 years. I certainly never imagined that I would help lead the school through a global pandemic. It has been an enormous challenge, but also an incredible privilege. I saw how the entire Bloomberg school community not only endured this crisis, but made discoveries, marshaled evidence, and advised the world. I am grateful that my path, though not at all planned, brought me to this moment today. You are all faced with challenges in your studies, and you will face them in your careers. But remember, you have the training, the tools, the determination to succeed, even if it's in unexpected places. Who knows? You might end up in the cockpit of a plane, in a remote corner of the Arizona desert, or in the halls of Congress. And maybe one of you will be in the dean's office. Your greatest accomplishments may be the ones you never planned for, ones you can't yet imagine. But I know that every one of you has the ability to adapt. And I know that whatever your path, your career takes, you will be a voice for change. You will make the world better through the power of public health. In 2020, I would not have predicted we would have been here together in 2022, but I am so glad we are. Thank you for joining us this weekend to celebrate, connect, and think about a brighter future that awaits ahead. And now it is my great pleasure to introduce your fellow alum, Congresswoman Lauren Underwood.
Thank you so much. Hello, Johns Hopkins Bloomberg School Public Health. I am so happy to be with you today. This has certainly been a long time coming. Thank you, Dean MacKenzie, for your kind introduction. And I also want to thank our school's second namesake, Mr. Michael Bloomberg, for his incredible record of public health advocacy. Listen, today is a day for celebration. I also want to acknowledge that each of you has been through something tremendously challenging. Your time at the oldest, most prestigious school of public health in the nation corresponded with a once-in-a-century pandemic. You completed your programs under incredibly difficult circumstances. You fearlessly jumped into your work during a pivotal moment in public health. You stood up and you met the moment. And you accomplished much of this, isolated from your classmates, your colleagues, and perhaps even your families. I also want to recognize the incredible faculty and staff here today who not only managed to pivot to online instruction, they facilitated connection and community in a virtual classroom. That is a difficult challenge, and their success is evident. Each of you has achieved something remarkable, but I have to tell you, the work has just begun. In this time of overlapping crises, we will create the future of public health. And friends, we have a lot of work to do. I have to say, being with you today brings back a lot of memories from my time in Baltimore. I remember my first day so clearly. It was 2008, and I was fresh out of college. Literally, I had earned my BSN just 8 weeks before. We were sitting in orientation, and a staff member began describing our class. She said something like, "There's even a 21-year-old nurse here." That's when I realized I was the youngest member of the class by a lot. I definitely sunk into my chair a little bit. I was intimidated, but thankfully, I met two of my best friends that day. H1n1 had already completed a dual doctorate in sociology and gerontology, and Reagan was a practicing OBGYN. She had her baby Indigo sitting in her lap. I mean, these were real adults, and I was in awe of them. That's how I felt about all of my classmates. I came to Hopkins to begin my career, and the people around me were well into theirs. It was inspiring as it was intimidating. H1n1, Reagan, and I immediately bonded. We all joined the public health program with a mission to end health disparities and improve the way that underserved Americans experience health care. H1n1 and Reagan validated my aspirations, and they inspired me to dream even bigger. They also listened to me talk about guys a lot. In 2009, a novel influenza emerged in Mexico. That fall, the H1n1 pandemic was underway, and I was working on my capstone project with the director of the District of Columbia Department of Health, Dr. Pierre Vigilance. What he knew that I didn't understand at the time was that in times of crisis or uncertainty, public health leaders must reach into the community. I'm not talking about doing a press conference or a big TV interview. Dr. Vigilance would meet people where they were. He would go on the black radio station in the afternoons, and he'd keep it real. He'd speak to the community as a member of the community. That's why people trusted him. In our field, trusted communicators save lives. Trust is the foundation of our work. What I'm saying is that in times of crisis, a billboard or a commercial will not, cannot do our jobs for us because trust requires relationship. Now, I didn't know it at the time, but my semester with Dr. Vigilance prepared me for an unimaginable challenge 10 years into the future, shaping the response to COVID-19 as a member of the United States Congress. Now, soon after my own graduation, I was hired for my absolute dream job at the U.S. Department of Health and Human Services. I loved my work, and I stayed at HHS until the very last day of the Obama administration. I had no idea what was next for me, but I wasn't about to stay at HHS and let the next administration take away health care coverage by repealing the Affordable Care Act, obviously. So I was at a turning point. At the same time, H1n1 began a new chapter in her life. She gave birth to a baby girl named Soleil. H1n1 was so excited to become a mom, but a few days after Soleil's birth, she began showing signs of serious postpartum complications. H1n1 went to the doctor 3 times during what turned out to be the last week of her life. H1n1 was 36 years old. She was one of approximately 700 mothers who lost their lives from pregnancy-related complications that year. H1n1's death was preventable, but her story is unacceptably common. H1n1 was on my mind as I moved from Washington, D.C. back to my hometown, Naperville, Illinois. It was around that time that I attended my then Congressman's one and only public town hall event of the year. The fight to preserve the Affordable Care Act was raging in Congress, and on that night, that now former congressman made a promise to my community. He pledged he would not vote to repeal health care coverage for people with pre-existing conditions. I took him at his word. So 2 weeks later, when he voted for a version of ACA repeal that jeopardized the health care coverage for 300,000 people in my community, people with diabetes or depression, or even a history of pregnancy, I had an epiphany. My community deserved better representation in Congress, and I could offer it. I was 30 years old, and I was running for Congress. That summer, I joined a crowded primary race with 6 other Democratic candidates. I was the only woman, the only person of color, and the only millennial. So let me be very clear. I was not the front runner. But I made the choice to be excellent. I went on tour across my Northern Illinois community. I marched in every parade, visited every VFW, every library, every Panera Bread in Northern Illinois. Seriously, I could tell you what to order at Panera. I talked with my community about my background, my career, and my values. But mostly, I listened. I met parents who couldn't afford their child's insulin, folks who sold their furniture to buy prescription drugs, and people terrified that their medical history would make insurance prohibitively expensive. It became very clear to me that my specific expertise would be valuable in Congress. The things that made me different made me powerful. The primary election came on a chilly March day. As I watched the returns come in, I was sure that there had been a mistake. But the numbers were right. I won my party's nomination for Congress with 57% of the vote. I won more support than any of the other candidates combined. As we transitioned into the general election, oh my gosh. As we transitioned into the general election, I was excited and I was scared. There were moments when I was sure that I would lose, moments when I found the level of attention on me truly frightening. But I never lost faith that I was doing the right thing because I wasn't alone. Our community of supporters grew with every phone bank and canvassing event. Our small campaign office began filling up with new staff and countless volunteers. We became a community, and our collective power grew. But this movement was not limited to Illinois' 14th district. Remember, this was 2018. Women across the nation were mounting serious challenges to established politicians. My team and I called them the girlfriends, as in the girlfriends around the country. And on November 6, 2018, something extraordinary began happening. The girlfriends started winning. My race was called around midnight. I heard people chanting my name. Honestly, I thought I might be hallucinating. I was elected to the U.S. House of Representatives with a 5% margin. That night, I became the youngest Black woman ever elected to Congress. And listen, not every girlfriend won her race. Most didn't. But every one of us showed thousands more what was possible when you steel your courage and you step into leadership. Here's what I want you to remember from that story. No one came to me and said, "Girl, you're the one." That responsibility was on me. I was confronted with an opportunity to meet the moment, and I stepped into it. To me, that's what leadership is. It's stepping forward, creating space, and inviting people to create something greater than themselves. I believe that that's a responsibility that each of us shares. And listen, your ability to lead is not tied to your age or years spent in our profession. It's about aggressively applying your expertise, speaking honestly, and boldly advocating for your community. So take it from me, you already have everything you need, and we need your leadership now. In January of 2019, I was sworn into the U.S. House of Representatives. As I got to know my colleagues, I met a fellow Black Congresswoman, Dr. Alma Adams from North Carolina. Now, as we chatted, we both discovered that our lives had been altered by the Black maternal health crisis. So we decided to do something about it. Now, because it's Congress, we gave our group of 2 a name, the Black Maternal Health Caucus. And I'll be real, I thought Dr. Adams and I would remain a caucus of 2. Today, the Black Maternal Health Caucus includes more than 100 members of Congress, Democrats and Republicans. And together, we've introduced a package of 12 bills to comprehensively address the maternal mortality crisis in America. You've heard of omnibus legislation? We call ours the momnibus. Last November, I stood next to President Biden as he signed the first piece of the momnibus into law, the Protecting Moms Who Served Act. That, my friends, is what can happen when Hopkins graduates step into leadership. As a nurse, I was trained to expect the unexpected. It's a lesson that has served me well in Congress. It was an evening in early 2020, the night of the President's State of the Union address, when I realized the novel coronavirus was like nothing I'd seen in my lifetime. As the disease spread across the country, it became devastatingly clear that the inequity that stole H1n's life made COVID a deadlier threat in Black and brown communities. As public health professionals, we must speak plainly and truthfully. And the truth is that institutional racism represents a public health crisis in this country. And it's not the only public health crisis that exacerbated COVID-19's death toll. Communities of color were specifically targeted with conspiracy theories and disinformation campaigns about the virus itself and the vaccines. These disinformation campaigns represent a public health crisis of their own. In uncertain times, and in the absence of trusted public health voices, seeds of doubt become very compelling, and people die as a result. We are in a fight for the truth, and I'll be real with you. We're losing. So today, I'm calling on you to add a new descriptor to your title, communicator. Whether you're a researcher, a public health administrator, a mental health professional, or a public servant like me, lives depend on us stepping up as public health communicators. And this is where our collective diversity becomes a strength. There will be times when you're the only public health professional of your gender or race, the only person with your background. You may be the only person who speaks your native language. These differences make your expertise and leadership critical, especially in a time of disinformation. And listen, this crisis of disinformation goes further than COVID. It's very much at play in the ongoing assault on reproductive freedom. So let me be very clear. Abortion is healthcare. I will state that at any podium I have access to, and I need you to do the same. For me, the gift of the past 2 years is clarity. The scale of the challenges before us is plain. The necessity of the work is clear. And yes, the magnitude of the crises before us can be overwhelming. The antidote is community, because that's where our greatest power lies. It's something that was easy to forget during the height of the pandemic, that we're all part of something much greater than ourselves. As I look at this audience, I think about the early days of my friendships with H1n and Reagan, how quickly intimidation became inspiration. I remember the girlfriends across the country. I think of all the volunteers with my 2018 campaign who have since mounted campaigns of their own and won. My friends, there is no one coming to save us. There is only us. But listen, I've seen the improbable become reality. I've seen change happen. I've made change happen. I'm the woman who shrank in her seat on the first day of our program, and I'm the woman who came back as a member of Congress. There's only us, and it is us. It is you who will make the future of public health. So today, let's celebrate everything you've done to make it to this moment. Tomorrow, Let's move forward. Let's make the future. Thank you and congratulations. Thank you.
Thank you, Congresswoman Underwood, for your words today and for bringing your voice for change and demonstrating the power of public health. I now invite all of the graduates here today to add their voice and join me in reciting the International Declaration of Health Rights, which you'll find on the back of your programs. This document, which was composed by faculty and students on the occasion of the School of Public Health's 75th anniversary, expresses the deepest aspirations of public health professionals and scientists. So if everyone would please stand, and I'll read, and if you can all say it along with me, that would be great. We, as people concerned about health improvement in the world, do hereby commit ourselves to advocacy and action to promote the health rights of all human beings. The enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being. It is not a privilege reserved for those with power, money, or social standing. Health is more than the absence of disease, but includes prevention of illness, development of individual potential, and a positive sense of physical, mental, and social well-being. Healthcare should be based on dialogue and collaboration between citizens, professionals, communities, and policymakers. Health services should be affordable, accessible, effective, efficient, and convenient. Health begins with healthy development of the child and a positive family environment. Health must be sustained by the active role of men and women in health and development. The role of women and their welfare must be recognized and addressed. Healthcare for the elderly should preserve dignity, respect, and concern for quality of life, and not merely extend life. Health requires a sustainable environment with balanced human population growth and preservation of cultural diversity. Health depends on the availability to all people of basic essentials: food, safe water, housing, education, productive employment, protection from pollution, and prevention of social alienation. Health depends on protection from exploitation without distinction of race, religion, political belief, economic or social condition. Health requires peaceful and equitable development and collaboration of all peoples. Thank you. I know that's a mouthful, so I appreciate you all staying with it and reading it out for me. So that declaration, which was developed in 1916 amidst a world war and actually on the precipice of what was to be a world-changing pandemic, as MacKenzie referenced, still rings true in so many ways today. And there's still so much progress to be made on all of those fronts, perhaps even more so given what we've all experienced over the past few years. And the collective voice of this community carries on the legacy of that statement by affecting change and demonstrating the power of public health in all corners of the world and of the field. And as representatives of that alumni community, I'd love to invite a few more of our distinguished alumni award winners to add their words of advice for our graduates. We'll start with Brandon Johnson, who's the winner of the 2021 Outstanding Recent Graduate Award. Mr. Johnson received his MHS in 2012 and currently serves as Public Health Advisor at the Substance Abuse Mental Health Services Administration in the Suicide Prevention Branch at the U.S. Department of Health and Human Services. He has led numerous projects aimed at specifically preventing suicide amongst African American youth and manages a resource center providing suicide-specific materials, webinars, and training to prevention-focused organizations and communities. Mr. Johnson is a tireless advocate for positive mental health and suicide prevention services for youth and adults across the country. So, Brandon, I'll invite you up now.
Good afternoon, everyone. It's so exciting to see so many of you here. I first want to say congratulations. You did it, even if you did it a couple years ago. But you did it, and I want to express my congratulations to each of you. As you all are embarking on this next level of your career, I know at some point when you made the decision, probably consulting family and friends to apply for Johns Hopkins Bloomberg School of Public Health, there was some passion that you had connected to you when you went for it. There was some passion that kept you up at night, something that was, on your mind when you really decided to make this step into Bloomberg School of Public Health. As you go into this next stage of your career, keep that passion with you. Keep that passion connected to you. You're going to encounter challenges. You're going to encounter doubt. You're going to encounter some things that are going to come up to, really push against that passion that you have, that drive that you have to do something with what you've done here in your time at Hopkins. And so as you do that, continue to keep that passion burning inside of you. So as it was stated, I work at the U.S. Department of Health and Human Services, particularly working in suicide prevention. I have encountered doubts, disappointments, failures, things that I just knew were going to work that didn't quite work. And some of the doubt, quite frankly, was internal. And so as I dealt with those things and continued to push, really centering my passion. And my passion is for suicide prevention for young people, particularly young children of color in the African American community. And so that's what I've held to. And I've been able to lead the largest suicide prevention program in the entire country for young people, leading a first of its kind initiative at SAMHSA focused on Black youth suicide, and continuing to lead the nation's largest suicide prevention resource center focused on all ages and lifespans. And it's really been the passion that's helped me to move forward. And so as I look at each of you, I see leaders. I see individuals who are going to make change, who are going to change systems, change people, change the way that we look at public health. And so I'm excited for you to go on this journey. And there are a couple of things, there are three things that I want you to do for me. One, I want you to lead with integrity. Integrity is so important. Congresswoman outlined it beautifully. Individuals need to be able to trust us. They need to be able to, understand what we're saying and see us in the places with the people that we're serving, to be connected to community and lending ourselves as voices to those who don't have the opportunities to sit in the rooms that we currently sit in. The next thing I would say after leading with integrity is to lead with tenacity. There are so many problems here, as been outlined by Dean MacKenzie and others, of so many things that we're facing, right? And some of the things that we're facing, we don't face personally. They're in groups that don't have voices, that aren't able to sit at these tables. And so continuing to fight for individuals, even if you're not from the community, as if you're from the community, because you're an extension of the community. So continue to lead with tenacity, even when things are tough. And lastly, but most importantly, lead with empathy. We are stewards of an opportunity as Hopkins graduates to be in places, in rooms where decision makers are. We're the decision makers, we're leaders, and we're driving these things forward. It's important for us to not forget the humanity that's connected to the work that we're doing. And there are people who are struggling with things that we are in positions to help solve. And that extension of leading with empathy also means for yourselves. So give yourself some grace. You are not going to be flawless on this journey. I can speak to you very confidently that you will not be flawless in this journey. I have definitely, made mistakes and have been very hard on myself. So it's so important for us to give ourselves grace and understanding that we're doing something difficult and we're working on something difficult. So when the times get tough, when doubt starts to creep in, continue to lead with affirmations, even if it's every day. You're looking at yourself in the mirror going, I'm capable. I have the skills, the resources, the passion, and the desire to make change, and I'm going to continue to do that. And also continue to rest. We need to recover and rest during these times where we're moving forward in such a complex position. And also to the graduates, also from marginalized communities, you all are stronger than any microaggression, any systemic racism, and anything that comes to tell you that you're not good enough, including imposter syndrome. You are enough, and you are able to get these things done. Believe in yourself. We are proud of you, and we are definitely appreciative that all of you are here, and we look forward to seeing the amazing things that you accomplish in your career. Thank you so much.
Thank you, Mr. Johnson. And now I'd like to introduce the 2022 Community Champion Award winner, Dr. Adam Milam. Dr. Milam has 3 degrees from Johns Hopkins, a BA, MHS, and PhD. Dr. Milam is a cardiothoracic anesthesiologist at Mayo Clinic and an associate professor of anesthesiology at the Mayo Clinic School of Medicine. He holds appointments at the Bloomberg School of Public Health and is a professor of practice at Arizona State University, where he is a national expert in addressing health disparities in adolescent substance abuse in neighborhoods and developing interventions to reduce adolescent exposure to violence, alcohol, tobacco, and other drugs. Throughout his career, Dr. Milam's work has focused on mentorship, community outreach, and boosting diversity in medicine. And that's the end of the formal overview on how impressive he is, but I'll also just add that Adam and I worked together as undergraduates with a nonprofit now known as Health Leads, which was working directly with patients and their families across the city. And I can say without a doubt that Adam's brilliance has impacted my own public health journey in numerous ways. So, Dr. Milam, what is your advice for these new alumni?
Thank you for the introduction, Sonia. I'm happy to be here. I've been smiling the whole event. I had the feeling that I had my first public health course listening to all the speakers and reminded why I'm in public health, so this has been great. I'm honored to have the opportunity to stand before you all this afternoon. 10 years ago, I defended my dissertation on the first floor of Hampton House just 2 blocks away. I cannot believe it's been 10 years. Following my defense, one of my committee members said, "Don't go to medical school. They're going to undo everything we taught you." I kind of brushed that comment off, but it definitely made an impact. I did my medical training, finishing just at the start of the COVID-19 pandemic, and everyone realized the benefits of public health training. Last year, I led a journal club with some of my medical trainees. One of the articles was about racial and ethnic health disparities in pain management. One of my colleagues told me he was not convinced about health disparities and health inequities. He did not believe they were real. I had no words for this statement. This colleague is a board-certified physician and has been practicing medicine for over 20 years. But this was not an anomaly. Hearing this comment made me think back to my final defense a decade earlier. Don't let them undo everything we taught you. Similar sentiments are held by physicians regarding diversity, and I'll read a quote from my article. "I believe that the same opportunities exist for persons of diverse race, gender, and sexual orientation to pursue a career in cardiothoracic surgery if they are able to compete successfully on a level playing ground for those training spots. If they are not capable of competing successfully for those training spots, then we should not deny the opportunity to someone who is qualified to appoint a lesser qualified individual solely for the goal of becoming more diverse." You can see how the same thought process applies to patients and the barriers they may face trying to obtain quality health care. The knowledge and skills you all obtain here at Bloomberg are invaluable and necessary. Bloomberg graduates, as everyone has mentioned, we need you. We need better integration of public health and medicine and more public health trained physicians and public health trained public servants, as the Congresswoman alluded to combat the major public health problems across the globe. But this task ahead of you is daunting. Take some time for yourself and your family, and I'm glad Brandon talked about that. Remember, this is a marathon, so pace yourself. Congratulations, graduates.
Thank you, Dr. Milam. And last but not least, we have Monica Guerrero Vasquez, who received her MPH in 2018 and was awarded the 2022 Community Champion Award. Ms. Guerrero Vasquez is the Executive Director of Centro Sol, the Johns Hopkins Center for Salud, Health, and Opportunities for Latinos, leading programs that serve families in Baltimore since its founding in 2014. A member of Baltimore's Trauma-Informed Care Task Force, she's working on a multi-year strategy to inform city policies and procedures to align with the best practices of trauma-informed care. A compassionate and skilled advocate, Ms. Guerrero Vasquez is advancing partnerships and programs that serve and support the growing Baltimore Latino community. So, come on up, Monica.
Congratulations, everyone. So I was asked to come here and tell you some words of advice and inspiration. It's very hard to be the last one. I don't think I can add too much, so let me tell you a story. Sonia, please stop me, because I love microphones. I'm standing here before you despite many odds. I'm an immigrant, woman of color, and I was very poor. But when I saw my parents working so hard, I thought, I'm going to go to college one day. But I never knew why or how or where I wanted to go. I knew, though, as an immigrant woman, if I go to college, it will secure a job for me and help my parents to stop working 24/7. Moving forward, I not only went to college, I'm the first generation in my family to go to college. I got 3 college degrees, and I got my MPH here at the School of Public Health, the best school of public health in the world. As the MacKenzie said, you never know where life is going to take you. But I recommend you to follow your dreams, because your dreams can be bigger than your fears. And don't believe the limitations of the world. You shouldn't, you can't, you won't. Those are limitations, external limitations. If you can dream something, you can make it happen. And to that end, I recommend finding a troop of mentors. At this point, I'm not scared to ask for help, but I was back then, many years ago. I didn't know who could help me, who has done this before, how people apply for college, how people get masters, what is a master's anyway? So I recommend to find the troop of mentors for you. Everyone around you here in this room could be a mentor for you. Your supervisors, your colleagues, your friends, ask for help. I'm very happy that I had a chance to meet Adam and Brandon today a little closer, because they are going to become my mentors too. And the last piece of advice or recommendation I have for you is work with others. You cannot do this alone. I would not be here with you if it wasn't because of the many people who have been with me, including the community members. When I graduated, my party was a community party. So I had all the families who have been working with me through many years at Central Seoul coming to my celebration. They were asking me, look, what is the degree that you just got? Like, what is that? How does that change the work that you're going to do with us? For them, it hasn't really changed. I am with them. I see them. I shop where they are. I go to mass where they are. I go to the events where they are. It's hard to have the life balance that we heard before. It is very hard. But if you can think of it and prioritize yourself as you prioritize the community, it is possible. So the last word, and just to repeat myself, is if you can dream it, it is possible. And health is a right. So if you can dream access to health care for everyone, it is possible. Thank you.
Thank you all so much. Over the past 2 days, we've been collecting your voices for change, both in person and virtually. And I just want to say thank you also to all of the graduates, all of the families, friends, support networks that have come out. We know that this takes time. You're all busy, as you've heard from our own alumni. There's so much going on in the world of our community, and we just really appreciate having space to be with all of you today. We had asked folks to speak to us about how they're hoping to use their voice for public health. And what we heard is that you are amplifying the voices of underserved communities. You are using your knowledge, your courage, and your voice to educate. You are integrating public health into clinical practice, and you are using analytical skills to impact primary health care delivery. And that's just a sample. There's so much more that folks out there are doing. If any of you in the room haven't had a chance to add your comments, we encourage you to do so before leaving today. For those online, please take a moment to post in the online board about your voice as well. You are the power of health, and we encourage you all to stay involved and to stay connected with this community. As you heard, we can't do this alone, and we have each other to be with and to rely on as well. The school's alumni team, including the amazing Erica, along with your department and program, is eager to strengthen this powerful network. And I'll just close out with this poem that I think speaks to the opportunity for healing and hope for all of us here in this room. When breathing is fear and laughing is vector, let us, in our faraway, socially distanced spaces, not forget to inhale slow. Allow our words and actions to burst forward. Keep our masks up, but our walls down. To let grow inside and outside vines of kindness, lit by the new atmosphere that we shape together. Thank you all so much for all that you're doing. Congratulations again to the 2020 and 2021 graduates, and enjoy the rest of your weekend, everyone. Thank you.